Welcome to the Ambetter from Magnolia Health podcast, where we bring you information on Ambetter Health Insurance and give you tools you can use to build a healthier life. Ambetter is health insurance available on the health insurance marketplace. I'm your host, Becky Martin, with Ambetter from Magnolia Health. In March, President Biden signed the American Rescue Plan, or ARP, which impacts the health insurance marketplace. In this episode, in 10 minutes or less, I'm going to tell you how the new law impacts current and prospective marketplace members. The American Rescue Plan affects the marketplace in three ways. First, enhanced APTC. Marketplace Advance Premium Tax Credit subsidies will be enhanced for 2021 and 2022, allowing eligible consumers to receive more APTC than in 2020. And eliminating the subsidy cap at 400% of the federal poverty level. The second way the ARP affects the health insurance marketplace is the unemployment income. People receiving unemployment in 2021 will be treated as earning no more than 133% of the federal poverty level, unless they are otherwise eligible for Medicaid. And the third way the ARP affects the marketplace is APTC overpayment. APTC subsidy overpayment in the 2020 tax year will not need to be repaid. Let's talk about enhanced APTC. The American Rescue Plan significantly increases APTC eligibility across all income levels, and this is done to improve affordability for 2021-2022. Individuals earning 100 to 150% of the federal poverty level may be eligible for free Ambetter coverage. That's zero premiums. Premiums are capped at 8.5% of income. To put this in monetary terms, a family of four who makes between $26,200 and $34,846 is at 133% of the federal poverty level. They may have contributed up to 2.07% of their income to a health insurance marketplace or ACA product in 2021. Under the American Rescue Plan, they may not have to contribute anything. A family of four who makes $78,600 to $104,800 is at 400% of the federal poverty level. They may have contributed 9.83% of their income to a health insurance marketplace product. Now, under the ARP, they may only contribute 6 to 8.5% of their income. If you already have an Ambetter plan, you need to go to Healthcare.gov to reassess your enhanced APTC or subsidy. And if you don't do anything, you'll receive the enhanced APTC that you're eligible for when you file your taxes next year. You can apply for the 2021 enhanced APTC anytime through the end of the year by updating your marketplace application on Healthcare.gov. And because the president extended open enrollment until August 15th, you can also switch plans when you go into Healthcare.gov. New health insurance marketplace shoppers can apply for coverage through enroll.ambetter.com from now until August 15th. Also, if you've previously shopped online and didn't qualify for a subsidy, now is the time to call an Ambetter broker or shop online again. I'll make sure you know how to find a broker at the end of this podcast. The second way that the ARP affects the health insurance marketplace is the unemployment income. Under the American Rescue Plan, people who receive unemployment in 2021 will be treated as earning no more than 133% of the federal poverty level, unless otherwise eligible for Medicaid. What that means is individuals receiving or approved to receive unemployment for at least 1 week in 2021 are eligible for fully subsidized ACA coverage at 133% of the federal poverty level if they are not eligible for Medicaid. In states that have not expanded Medicaid, people below 100% of the federal poverty level will also be treated as making no more than 133% of the federal poverty level for APT subsidy eligibility. Individuals may need to attest to and provide documentation to prove eligibility. Healthcare.gov should release more information on this in July. Healthcare.gov probably won't have their website updated to accommodate those who are unemployed and seeking ACA insurance coverage until summer 2021. And the third way that the American Rescue Plan affects the health insurance marketplace is APTC overpayment. APTC subsidy overpayment in the 2020 tax year will not need to be repaid. The provision applies to all marketplace consumers regardless of income. It doesn't apply to 2021, only overpayment in 2020. The IRS is currently working on implementation plans and are strongly encouraging consumers who have already filed their taxes not to file amended returns related to the ARP at this time. If you have questions about reassessing your subsidy and you already have a broker, please call them. If you don't have their contact number or you'd like advice on shopping for an Ambetter plan, please go to ambetter.magnoliahealthplan.com. Click on Our Plans and then go to Find a Broker. Thank you for joining us for the Ambetter from Magnolia Health podcast. You can find this episode on our website, ambetter.magnoliahealthplan.com. Remember to like Magnolia Health on Facebook and subscribe to Magnolia Health on YouTube to check for details on the next podcast. Ambetter from Magnolia is underwritten by Ambetter of Magnolia, Inc., which is a qualified health plan insurer in the Mississippi health insurance marketplace. Ambetter of Magnolia, Inc. complies with applicable federal civil rights laws and does not discriminate on the basis of race, color, national origin, age, disability, or sex. This is a solicitation for insurance. Copyright 2021, Ambetter of Magnolia, Inc., all rights reserved.